Hi, I'm Dr. Liz Yates Horton. I'm here to talk to you about telehealth in the neuro population. You may be thinking, how the heck am I supposed to see someone who has a neurological diagnosis on the computer? When we think about it, you think hands-on, you think safety issues, lots of cues, maybe high level equipment, but it is definitely doable. Um, when I came up with the idea to start seeing people via telehealth, it was because I had a group that was traveling over an hour to come see me. Either they had Parkinson's and they lived in an area that didn't have a Parkinson's specialist, or they had a vestibular disorder and was dealing with dizziness and hadn't been able to find someone who lived near them that could really effectively provide them a treatment. And so these people who either had mobility issues or were really dizzy were getting in their car, and either they were driving or a family member or friend was driving an hour to come see me. This is not an effective or an efficient way to deliver care for these individuals. And so this is where I came up with the idea. Um, and it is really doable as long as you are taking into consideration safety. So when I see someone for an initial evaluation via telehealth, I always make sure that they have a caregiver, family member, friend there with them. This is twofold. First is it provides a safety net. Also, they can be my camera person, which is very helpful. A lot of times, there's a lot of figuring out in terms of where the camera needs to be. So I can really effectively see how someone's moving in their environment and I'm not looking up at their ceiling or down at their floor. So things to take into consideration in terms of equipment. All someone needs as a patient is a smartphone, a tablet, something that has a camera. And the number of people who have smart devices is really grown over the last couple years in this older population um, that I'm typically seeing. And so if they don't have it, a family member or friend does. I am using a HIPAA compliant um, platform. So for my practice, we use Zoom, which is HIPAA compliant. Recently, there's been some Medicare changes where there is some opening in terms of what you're using and that it doesn't need to be HIPAA compliant, but this is best practice. We want to make sure everything we're doing is HIPAA compliant. So Zoom is a great option, and there really is a um, growing group of platforms that are out there. You want to make sure that the space that they're sitting in as you're getting a history is fairly well lit so you can see what's going on. And as you're getting a history, taking in what their environment looks like. This gives you so much information that we don't get when someone's coming to outpatient therapy. In terms of a mobility assessment, it is really, for me, function based. For someone with Parkinson's or, balance issues or other neurologic conditions. So I'm taking a look at how they're walking. If they and the person who's with them is able to measure out 3 meters or 10 feet, I'm able to do a tug with them. If they have a long hallway, I may be able to do something like the DGI or the FGA with them. So really, you're not limited as long as you have someone with you and you're using and keeping safety in mind. You can really get a good look at how they're moving in their environment. In terms of vestibular, um, I'm able to see if there's spontaneous nystagmus. You can really go through a lot of your ocular motor exam, um, basically with a camera. I can talk through, let's say someone has BPPV, I am able to talk through either the person who's dizzy and or their caregiver, friend, and family on how we're going to do testing. And we're going to use their camera on their phone so I can see what's going on with their eyes. They're talking me through how they're feeling. And then from there, we can do, repositioning maneuvers. And I have videos. So if this is something that we are going to be doing in a session, I have videos that are already made up that I can just send a link to. So that way they're able to pull that up in our session and get a preview of what we're going to be doing. So, just planning ahead. So if I know I'm seeing someone who's dizzy, and from talking to them on the phone or an email, it sounds like it's BPPV. I have that in my toolkit that I'm going to send out to them, so that way they know what to expect on their end. And my documentation is the same as if I was seeing someone in person. I am just documenting that I'm seeing them via telehealth in a synchronous model. And I just document the reason why I saw them via telehealth. You want to make sure that you're checking in with insurances. So right now, because of COVID, pretty much everyone is allowing for telehealth. This is most likely going to change, as things start to reopen. So you want to check every insurance that you're seeing specific, know the guidelines, know best practice for that, and just trying to think. And then you may, if you see someone via telehealth, it may be a hybrid where you're seeing them via telehealth for some sessions, in person for some sessions. And that, I think, is actually the best model. It's great to be able to see someone in their home, see how they're actually moving. They're not having to travel to come see you. And then being able to see them in the clinic, do hands-on. I think that's really great. If you get through or start an eval and you're like, whoa, like this is not safe, or I don't feel like I'm going to be able to do an effective job, then finding someone who's close to them that you can refer that person to. Being open and communicating that is really important. And then reaching out to that person you're referring them to, filling them in about what's going on. And if this is an area that you're an expert in, and say that person you're referring to is more of a generalist, it's always great to offer to help. So not only are you helping that clinician, you're also helping that patient that had reached out to you. I am always open if anyone is interested in telehealth. If you have any questions, you can always reach out to me. You could even come and see what a session looks like. When I did the UPDRS with Bernadette, that was via telehealth. So there's a separate video showing just what the setup looks like on my end. But telehealth is, I think, here to stay. So this is really an exciting time for our profession in terms of integrating technology and really making what we do accessible and making best practice to patients accessible. All right, I hope you found that helpful. Dr. Du Bois is also providing you a handout that has easy assessments, outcome measures that you can do via telehealth, that even has norms. And that, I think, is a really great resource when you're starting out, because you are probably going to be questioning, how the heck am I going to do this via telehealth? And that's just a tool in your toolbox.